Hello, my name is Rick Lomax from the Sustainable Development Unit. Today I'm going to talk you through how to use the Health Outcomes of Travel tool using the provider non-ambulance interface. So this is for non-ambulance providers such as community trust, mental health, acute, etc. On opening the tool, this will be the introduction tab that you'll first see. I'm going to run you through how to use the provider's non-ambulance interface. So if you click the tab red at the bottom, this is what the interface will look like when you open it up. First thing you want to do is use the drop down menu to select your specific trust you want to do analysis on. In this example, I'm going to use the all providers non-ambulance, which is the sum of all the providers across the NHS, so it allows you to do that regional analysis across England. Next thing you want to do is to select the baseline scenario year. So in this case, because we've used the all providers, please make sure you use the 2015 input as the little note there. Next thing to do is to name the analyst, provide the date of the analysis that's being performed, and the last box here is really useful so you can define the purpose of your new scenarios to remind yourself what you're trying to achieve. Next stage is to name the specific scenarios. So I'd suggest scenario 1 be an actual baseline, and I'm going to choose the year 2015. The actual baseline is really important. The tool creates and uses a lot of assumptions. Creating an actual baseline is really important. The tool has lots of assumptions within it, so creating an actual baseline allows you to test those assumptions and put in more accurate local data where it's available. The next thing we want to do is create a new scenario, so we're going to suggest that there's an improved bus service for patients to access your main site. We're going to assume that that increases the modal share up to 20%. I'm going to assume this analysis is being taken in 2019, so I'm going to select the year. It's really important to create a business as usual profile for the same year. Within the tool there is already some projections of how the average UK car between now and 2030 is going to change in terms of its average fuel mix, in terms of how fuel efficient it is, and also the type of emissions it can release. What we're also going to do is to test a new electric vehicle fleet for business mileage, and we're going to assume that's responsible for up to 40% of the modal share. And we're going to assume that this analysis is being undertaken in 2023. Again, create a new business as usual profile to compare your new scenario with. As you can see already, a lot of the information is already being populated. This is just based on your baseline year and the years for each scenario. What we need to do now is to go down and go to section B, which is the data entry. There's lots of things you can change here. So the numbers of people in terms of staff and patients, you can change the number of FTEs for your organisation. You can also change the clinical activity, so outpatients, A&E admissions, admissions without day cases and bed days. You can also change the number of journeys for patients and visitors. You can also change the distances. A lot of this information is going to come from a staff or a patient travel survey. So if you do have access to that information, please feel free to edit and update these. You can also update your business mileage. So this is for the whole NHS, but when you're using it for your trust, you might want to update this with more accurate local data. Next, we can change and specify what the patient travel modal share looks like. So in this demonstration, we said we were going to improve the modal share of buses up to 20%. Then what we need to do is to, as you can see from this error, that it says the modal share is above 100%. So what we need to do is to dial back some of the modal share over modes of transport. And for ease here, I'm going to assume that the modal share the new bus route is going to reduce is directly from car van driver and car van passenger. So I'm going to quickly do a formula to reduce the business modal share of these modes of transport. So you can see now that's gone back to black, which means it's 100%. You can also edit the composition and the fuel makeup of the car fleet used by patient and visitors. As I mentioned previously, these figures come from DFT projections of the average UK vehicle. And its composition of fuel types are diesel, petrol, electric, and you can see over time the modal percentage of electric vehicles is increasing. If you've got specific patient travel information of the fuel type, then please feel free to edit these. If not, leave them as they are. You can also edit staff commuting modal share. I'm not going to do it in this demonstration, but obviously if there was a new bus service, the co-benefits of this new bus service is you'd hope staff would also increase their uptake. So it's something you might also want to model. Again, you can edit the composition of the car fleet used by staff in terms of commuting. So if you've got grey fleet mileage information from staff travel surveys, then you can update this information here. And you can also update the composition of car fleet for business mileage against the fuel makeup type. We are going to change this figure, and I've already done it here. So I've updated the percentage of electric vehicles to 40%, and then I've modelled the same ratio split between diesel and petrol as the example, the baseline business as usual for the same year. Next data entry is around the impacts from accidents. The tool understands the health and societal cost impacts of accidents from patient and visitor travel and also staff commuting. What the tool currently does is it assumes that there's no accidents from business mileage, and that's what this no data box does. That's assuming there is no accidents from business mileage. The other elements are modelled on average impacts per kilometre in your local authority area. So you can select that if you wish to add those figures into the impact assessment, or if you've got specific information on incidents that have happened during business mileage, then you can put in user defined figures. For this example, I'm going to leave that as default 0 as no data. So that's the data entry complete. Next, you want to look at the detailed results. So you can see at the top you've got the different scenarios as you've named them, the improved bus service and the business as usual. So scrolling down, you can look at for instance, the PM 2.5 emissions from the improved bus service is lower than the 2019 business as usual profile. And when we scroll down to the staff commuting and business mileage section, you can also see the new electric fleet has also got a reduction in NOx and a reduction in PM 2.5. If you scroll down to the bottom, you've got a sum of the economic cost. So this is the cost to health in terms of death and cost to society in terms of greenhouse gases. So you can see the difference here of these two initiatives is £5 million within the staff and business travel. If you scroll back up to the top, you can see the net results of all that you've modelled. You can see here that the patient and visitor modal share has now changed. So you've got a far greater use of buses. And we can also see how the impacts change. We're doing the national level assessment, which means the difference between these values seems quite small because we're talking about £500 million worth of impact. So when you look at the detailed results, you can see some specific information. But you can see the pound economic loss has gone down by a net of over 4 million, so it's quite a significant value. So in essence, that's how you use the provider non-ambulance user face. You can see more information on the assumptions and the process within the full detailed guide on the SDU website. Thank you.